Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Patricia Favila, Executive Director of Pharmacy Services at Community First Health Plans. And today we're going to talk about how her team is using data, provider collaboration, and value-based care models to advance antibiotic stewardship. We're excited to have you here today, Patricia.
Thank you. I'm glad to be here today.
So to get started today, just tell me a little bit about your background and your role at Community First Health Plans.
Sure. Again, I'm Patricia Favila, and I work for Community First Health Plans. We're a small health plan, local, based in San Antonio, Texas. We are a nonprofit health plan, and we serve Medicaid, Medicare, commercial, and marketplace members. My role involves overseeing all aspects of pharmacy services, including utilization review, formulary management, and quality clinical programs.
So let's talk a little bit about antibiotic stewardship. We know that this has been a long-standing challenge in healthcare, but what made it a key area of focus for your team, and where did you see the biggest opportunity to drive change?
We started to get concerned because there are not a lot of new antibiotics in the drug pipeline, and there is growing antibiotic resistance. And our goal was to support providers and provide education and provide a collaborative environment for them to make a positive change.
So you guys have taken a multifaceted approach to improving antibiotic stewardship, combining education, data, accountability. Walk us through what your model at Community First kind of looks like.
Well, it really focused on three main pillars. And our first was data transparency. The second pillar is education, and the third pillar was collaboration. Once we learned our data, we started back in 2016, and we looked at where we were. We had a baseline and where we wanted to go. From there, we started to meet with our top 10 provider groups and really had good conversation about how they could help us and how we could help them. We made this a two-way dialogue, and providers shared their barriers, and we worked on solutions together.
And I know you've emphasized that collaboration is key and has been a cornerstone of this approach. How are you able to keep providers engaged and aligned with your stewardship goals over time?
We noticed provider engagement is absolutely key. And so meeting with them on a regular basis is the key to that engagement. And we also have several touch points in between quarterly meetings. We also include our medical directors so that they feel like it's more of a peer-to-peer conversation, and that seems to really help.
So you guys have been tracking antibiotic measures for several years now, and were just recognized by NCQA for your performance on HEDIS antibiotic measures. What progress have you seen since launching these efforts?
We've seen tremendous progress and a huge success. And we're very proud that we've been able to turn the ship around. But again, it takes patience, perseverance, and partnerships with your key provider groups.
Your team has also tied antibiotic stewardship to value-based care initiatives. How have alternative payment models helped reinforce appropriate prescribing behaviors?
Financial alignment is an important motivator. And when you incorporate those same HEDIS metrics into a provider incentive, it reinforces the message that antibiotic stewardship is important.
What excites you most about the future of antibiotic stewardship, and how do you see data continuing to shape more responsible, patient-centered care?
I believe with AI, I think that this is really going to be the key to helping providers, especially providing data at the point of care. I think this is an exciting area, and there will be more to come to improve member outcomes in this regard.
You've been tracking antibiotic measures for several years now, and were actually just recognized by NCQA for your performance on HEDIS antibiotic measures. What progress have you seen since launching these efforts, and what has that impact looked like?
We've seen tremendous progress over the last few years, Justine. In fact, it took a village. First, we had to meet internally at our organization and really look at take a good look at the data. After we did that, we engaged our top 10 provider groups. and they were really interested. They wanted to do better, but the only way they can do better is if they see their data. And so once we started sharing the data with them, sharing all outliers, not in a punitive state, but rather to help them make those positive changes, and then keeping meetings scheduled is really what helped.
Patricia, it has been a pleasure sitting down with you today. I really appreciate you being here and, of course, for your continued partnership with Inovalon.
It's been my pleasure. Thank you.
And thank you so much to our audience for watching today. Keep an eye out for our next INOvators episode.